The objective of this module is to describe suggested steps to evaluate your trained rapid plan model. There are 4 general steps to follow when evaluating your model. 1. Review the model training log. 2. Review the clinical versus estimated DVHs for each structure in the model. 3. Review the geometric box plots for each structure in the model. And 4. Review the residual and regression plots for each structure in the model. Before moving forward, we will need to define several key concepts used in the evaluation of a model. These include geometric outliers, dosimetric outliers, geometric box plots, regression plots, residual plots, and DVH plots. Geometric outliers include patients with one or all of the following characteristics: a PTV volume or PTV shape that differs substantially from the majority of the training set, a specific structure volume or shape that differs substantially from the majority of the training set, or a positional relationship between a structure and the PTV that differs substantially from the majority of the training set. This may include the amount of overlap between a structure and the PTV, or the volume of a structure within the in-field or out-of-field regions. Dosimetric outliers are patients where the clinical DVHs differ substantially from the estimated DVH for one or all structures included in the model. A dosimetric outlier can have a clinical DVH that is greater than or less than the estimated DVH. Geometric and dosimetric outliers can influence the estimation ability of your trained model and should be identified during the model evaluation. Outliers can be identified using several tools provided in the DVH configuration workspace. Geometric box plots are provided for each structure included in the model. These box and whisker plots display the variation in the model's geometric parameters. The plots can be used to identify geometric outliers in the training set. Regression plots are provided for each structure included in the model. These plots illustrate the correlation between the first DVH principal component and the most important geometrical regression parameter either alone or in combination with other identified geometrical regression parameters. These may include the volume of the organ at risk, overlap between the PTV and organ at risk, or a principal component score of the geometric-based expected dose. These plots can be used to identify geometric outliers and influential data points in the training set where the clinical DVH principal component substantially differs from what is expected by the geometrical regression parameters. Residual plots are also provided for each structure included in the model. These plots illustrate the correlation between the first DVH principal component and the first estimated DVH principal component. These plots can be used to identify dosimetric outliers where the clinical DVH principal component substantially differs from the DVH principal component estimated by the model. The DVH evaluation window for each structure displays the clinical DVH versus the DVH estimation range. The DVH estimation range represents one standard deviation of the spread in the training data. These plots can be used to evaluate if your model is properly identifying the variation in your training set DVHs. In addition, the DVH plots can be helpful in identifying dosimetric outliers where the clinical DVH falls outside the DVH estimation range. Now that we have defined several key concepts, we will transition to discussing each step in detail in the model configuration workspace. The first step is to review the model training log by opening the training log here. The training log indicates that the model was successfully trained and that no errors occurred. In addition, it can be used to evaluate the model's estimation ability using the goodness of estimation statistics. In general, a larger value for the coefficient of the determination for the regression model parameters indicates a better model fit. However, if the value is close to 1, this might indicate that the model is overfitting the data, and adding more training patients might be necessary to improve the estimation capability of the regression model. In addition, the outlier column provides a tooltip that gives you values for several statistics calculated during the model training. These statistics include the Cook's distance, modified z-score, studentized residual, and the areal difference of the estimate. These statistics can be used to help identify geometric and dosimetric outliers in the training set. Further details regarding the training log and outlier column statistics can be found in the Eclipse reference guide. The second step is to review the DVH plots. In the lower right-hand window, select the PTV DVH plot. You should notice that all PTV DVHs are clustered around 100% of the prescription dose. If you notice any DVHs that are normalized significantly lower or higher than the 100% of the prescription dose, this may be due to a planned prescription dose that does not match the clinical plan. You can highlight the DVH in the context window to identify the corresponding patient ID, or you can select the patient ID to highlight the corresponding DVH. You can then proceed to reviewing the extracted clinical DVHs versus the estimated DVHs for each structure in the model. The purpose of this step is to evaluate if your model is properly identifying the variation in your training set DVHs. For example, we will show you the bladder DVH plots. You can select each plan in the training set to review if the clinical DVH falls within the bounds of the estimated DVH. It is expected that there will be some clinical DVHs that fall outside of the estimated bounds. This indicates that these patients may be geometric or dosimetric outliers and will be evaluating using other tools provided in the evaluation workspace. Review of the clinical DVHs versus the estimated DVHs should be repeated each time a rapid plan model is trained. The third step is to review the geometric box plots for each structure. These plots display the variation in the model's geometrical regression parameters. By clicking on the individual patient, you can see the correlation between these parameters. For example, patient number 11 is likely a geometric outlier for the bladder structure. It has a large bladder volume, large out-of-field volume percentage, and a small organ at risk overlap volume percentage. A substantially larger structure volume typically correlates with a DVH that looks something like this. You can make note of potential outliers based on the geometric box plots and further assess them in the final step through review of regression and residual plots. Review of the regression plot discussed previously can help in identification of geometric outliers and data points that may heavily influence the regression model. Geometric outliers commonly exhibit one of two distinct characteristics on the regression plot. The data point deviates vertically from the regression line, or the data point is isolated from the majority of the other data points. Patient 11 discussed earlier is an example of a possible geometric outlier that deviates from the regression line for the bladder, likely caused by a large bladder volume extending out of field. A second geometric outlier characteristic is exhibited by patient 40, which is far from the rest of the data points. This patient is a geometric outlier on the other end of the spectrum with a small organ at risk volume and a large percentage of organ at risk overlap, as seen as the geometric box plots. One can expect a DVH for this type of geometry to look similar to this. When you come across outliers such as these, it is recommended to evaluate their impact on the model estimation by removing them from the training set and retraining the model to determine the amount of influence on the estimation. If geometric outliers heavily influence the model and represent a subset of patient geometry that you intend to use the model for, it is recommended to add additional training patients with similar geometry. It is suggested that the regression plot not have any data points that are isolated from the majority of the other data points unless these data points have been reviewed carefully and a conscious decision has been made to include them in the model. Finally, review of the residual plots can aid in the identification of dosimetric outliers. Data points that fall above the identity line indicate clinical DVH principal components that are greater than those estimated by the model. For example, this data point suggests that patient 14 has a clinical bladder DVH that is greater than the DVH estimation range. This correlates well with the DVH plot. It is slightly difficult to see, but the highlighted blue clinical DVH is greater than the blue shaded DVH estimation range. When analyzing the residual plots, keep in mind that not all of your data points are going to fall within one standard deviation of the mean indicated by the dotted lines here. However, you want a narrow spread to ensure that the amount of noise in your training set is reasonable. If there are any plans that fall significantly outside of the predicted range, you might consider replanning this patient to ensure a high-quality training plan that spares organ risks as much as possible. Another consideration when evaluating the residual plots is the data points that fall far away from the majority of the other data points. For example, this data point for patient 40 is located far away from the rest of the data points, but is still located on the identity line. Even though this patient is a geometric outlier, dosimetrically the DVH estimation correlates well with the actual clinical DVH as seen here. You can imagine if this DVH was not adequately optimized and the actual DVH principal component was greater than the estimated, that this data point may skew the entire regression line and still appear to fall close to the identity line. Therefore, it is necessary to carefully consider dosimetric plan quality when deciding whether or not to include these outliers in your training set. After your model evaluation is complete and you have identified patients or structures you want to remove from your model training set, you can do so in the plan list above. You can either uncheck the Include box to exclude entire patient from the training set, or you can unmatch one of the structures to exclude one or more structures from the training set by selecting this button and deselecting the structure you wish to exclude. Remember that a minimum of 20 structures for each structure type are needed to train a model. Each time you remove a patient, the regression model will change, and as a result, the estimated DVHs will change as well. It is recommended to remove influential data points and outliers and retrain and reevaluate your model iteratively. Once the appropriate patients and structures have been removed, you can retrain your model and repeat the evaluation process, including review of the clinical versus estimated DVHs. This completes the discussion on the main steps used to evaluate a trained rapid plan model. To review, there are 3 main actions that you can take to improve the quality of your model. These include 1. Adding more patients to the model to address overfitting. 2. Removing identified geometric outliers or adding additional patients with similar geometry to the identified outliers. And 3. Replanning possible dosimetric outliers to improve organ at risk sparing while maintaining PTV coverage. You are now ready to validate your rapid plan model.